Hello, everybody. I'd like to introduce our second speaker, and her name is Sharone Franzen. She grew up in San Francisco. She earned her Master of Science in Chinese Medicine at the American College of Traditional Chinese Medicine in San Francisco. She runs her own Chinese medical clinic in San Francisco. She specializes in treating pain and mood disorders and also facial rejuvenation. There are conditions for which Chinese medicine might be preferable to conventional medicine. This lecture will explore the ways in which acupuncture and herbs work to address most health issues. Understanding these points will demystify Chinese medicine and show how it can respond to modern ills. Let's give her a big welcome, Sharone.
Thank you. Can everybody hear me okay? Opted for the little rock star thing. So, my name is Sharone. I'm an acupuncturist. Have any of you had acupuncture before? Yeah? Oh, a lot of you. Good. Did you ever wonder why the acupuncturist asks you so many questions? No? Very nosy, right? Any acupuncturists here? No? Oh, okay. All right. So if I say anything incendiary, he'll back me up? I don't have to run out of here by myself? Okay. I kind of figured you would. Okay. I wanted to talk to you tonight about Chinese medicine, and particularly the how of Chinese medicine. We all know, I'm assuming we all know the what of it. The little skinny needles, they go into the skin, they move the qi, they move the blood, all that stuff, right? So, but the why of it is, I think, even more interesting, and it's a little bit mysterious. So, sometimes if somebody might be a little skeptical about Chinese medicine, they might say, you know, Sharone, your medicine, it's really ancient. What does it have to do with us today? You know, doesn't modern medicine have enough to offer us? Doesn't it cover everything? And all of these ills that we have that are because of our modern society, how can acupuncture and herbal medicine possibly address those things? And then sometimes when somebody's known me for a long time, they'll say, you know, Sharone, every time I talk to you, it seems like there's another illness that you say, oh, I can treat that. And, you know, what's the deal with that? Why does Chinese medicine treat so many different things? Isn't it really just good for pain? So I want to answer those questions by showing you a little bit about how Chinese medical differential diagnosis works, okay? And once you get a little bit of insight into that, I think that the answer to all these questions will become more clear, okay? Okay, so there's a lot of different ways to diagnose in Chinese medicine. You can use meridian theory, you can use organ theory, you can use external pathology, but what all of those types of diagnoses have in common is that they're all driven by symptoms. So, once you collect enough symptoms from a patient, then you can organize these symptoms into syndromes. And it's the syndrome that we treat, not the name of the disease, okay? I'm going to show you what I mean by that. And you know, I'm really encouraged by hospitals and medical centers that are now using acupuncture as part of their patient care. But you know, keep in mind that acupuncture and herbal medicine were developed together. And I really do believe that taken together, it makes the medicine a lot more powerful. So yeah, we have some work to do on that. All right. So what I'd like to do is just show you the really easiest way to diagnose somebody. It's called the 8 principles. I love this. It's simple. I tell my students to use this if they're in hot water, you know, either in the clinic or, you know, if they're doing a case study and an exam and everything just looks too crazy. I say use the 8 principles. And you can see it's not complicated, right? Okay, so for example, right up here, we have the first pair, heat and cold. Easy, right? If you feel all of a sudden like you've kind of got the chills, you're starting to ache, you're starting to feel that feeling like, I think I'm catching a cold. Maybe you're sneezing, stuff like that. That's cold. Simple, right? So if you're in your kitchen and you're rummaging through your cabinets and you're trying to figure out what might suffice for an herbal remedy for this cold, cinnamon tea and ginger. Those are nice, spicy, warm herbs to combat the cold. You can chop up green onion and put it in some hot chicken soup. Also warm, spicy, that'll combat the cold, right? Wrap yourself up, go to bed, sleep a little extra. It's very possible that you may wake up the next morning feeling just fine. Now, of course, Chinese herbal formulas are a little bit more complicated than that, but they do have some of these ingredients in them. And sometimes this food/spice remedy is all you need. Trust me, I've done it from my own kitchen, so with nothing fancy. Okay, so heat. Say you get up in the morning and you have this red, raw, aching sore throat. You're coughing, your mucus is yellow, sticky, that's heat, right? So the opposite is true. What might you find in your cabinet that's a little bit cooling? What do a lot of you probably have in your tea cabinet? Any of you can think of? Peppermint. It's great. Great for sore throat, okay? Now, if your sore throat is really severe, maybe peppermint might not do it. If you have it growing in your yard, that might be better. If you use Chinese mint, it's a little bit more powerful, but still, that might do the trick. All right, so of course, if you have really severe heat or really severe cold, you can call your acupuncturist, whom you're already seeing for, you know, low back pain, and she can give you a good treatment and give you a good herbal remedy, and she can probably knock off days from your illness, okay? Okay, so let's go to excess and deficiency. A little bit more complicated, but you can do this. Excess is the 2 things we just talked about, okay? A cold, a viral infection, anything acute can be considered excess. Deficiency might be something a little bit more chronic, something a little more lingering, okay? So you have a cough, but you've had a cough for a long time. The virus is gone, but your body just isn't at its best. That's deficiency, okay? So exterior and interior, yang and yin, those are a little bit more complicated. Suffice to say that they also use polarity in order to diagnose something, okay? Okay, so let's go to something else, something a little bit more complicated, okay? Let's go to organ diagnosis. Okay, this one's really crazy. So we use, what I'm using here is I'm using asthma as my disease name, okay? Now, if you look at this, this isn't all the differential diagnoses of asthma in Chinese medicine, but it's some of them. And I do like to tell my patients what their Chinese diagnosis is, with the caveat that if I tell them that they have, you know, liver qi stagnation or kidney qi deficiency, don't run to your physician and tell them about this and say, oh my God, you gotta check my liver and my kidney. It's according to Chinese medicine, okay? It's a different paradigm. There's nothing wrong with your liver or your kidneys per se. And if there is, in my world, then I'm responsible for fixing it, right? So you can see here there's a lot of symptoms. And when you're hearing some of these symptoms, you might wonder, okay, what does low back pain have to do with asthma? Right? This sounds crazy, right? You know, why are acupuncturists always asking you about your bowel movements? They're nosy, right? What does any of this have to do with asthma? These symptoms sound like they're really random, but they're not. The more and more you use this system, the more you see patterns reoccurring in human beings. Now, nobody's textbook, right? Most people are going to have a mixture of 1, 2, 3, maybe even 4 patterns going on. And then you have to decide as a clinician which one you're going to take first. But, okay, so I put some crazy things in here just to kind of show you how this works. So you can take that 8 principles and you can overlay it onto this, okay? So you can see which ones are hot, right? Liver fire, okay? Fire is hot. Look at what the symptoms are like. Red face, that sounds hot, right? You know, they're coughing up something yellow rather than clear. Their urination, it's dark urine, right? All hot. Same thing with lung phlegm heat, hot, right? Bright yellow urine, red cheeks. Barking cough is like, what do kids get? Croup, right? That kind of thing. So, for the hot conditions, I'm going to give what kind of herbs? Cold, right? And vice versa. Now, you can also overlay excess and deficiency on this, right? I mean, well, it says it in the name, so that's kind of cheating. Spleen qi deficiency. But something like liver fire insulting the lungs, without me having to super explain how that happens, it's not very common, but you can see that's not a deficient case. That's something raging, right? Whereas spleen qi deficiency, kidney qi not grasping, lung qi deficiency, that's deficiency. Something's not working right to begin with. It's not it's not a pathogen that's come and attacked, right? All right, so it's really important in my medicine for me to collect all of this information so that I can give a good acupuncture treatment and give a good herbal treatment. Acupuncture, whatever pattern that I've seen here, I'm going to decide a different acupuncture treatment, probably based more on the symptoms that are really related to asthma or wheezing or the lung capacity, right? And then as far as herbs go, I'm just going to treat the pattern, okay? Now, if I can convince somebody to take raw herbs, a raw herb formula, which is not always easy, I can then further modify their formula. I can add herbs, I can subtract herbs, and make it exactly perfect for the person's constitution. And the other thing I can do is I can change it. Every 2, 3, 4 days, I can change it. So that as the symptoms fall away, I can change the formula to address what is going on that day, that week, that month, etc. Okay? Now, eventually what ends up happening when you start to do this is that the little symptoms that somebody came in with that they weren't really complaining about until you started asking all your million questions. You know, maybe their insomnia, their digestive issues, it maybe doesn't have anything in their mind to do with their asthma, but all these things start to fall away. And their asthma also improves. And then they're very happy, right? And then the patient is really experiencing firsthand what holistic medicine really means, okay? We're not treating a body part, we're not treating a disease, we're treating the whole person, So this whole idea also works in the inverse, okay? So this is a formula. If you've been to a Chinese herb shop, you've seen this because very commonly prescribed. Gui Pitong is for something that we call spleen qi deficiency and heart blood deficiency, okay? So the patient I give this to might have come in for insomnia. That was their chief complaint. They might have come in because they have digestive disorders. They might have come in because they've been studying their brains out and they just can't seem to concentrate anymore, okay? But look at all of these biomedical applications. If we're going to use the Western medical terminology, I just took out of a very long page of possible applications, I just took a few that seemed somewhat disparate to me when you compare them, right? These seem like unrelated disorders when you just take them at face value like that. But if they fit the pattern, it's going to work, right? The patient has to fit the pattern. All right, so let's see. There's something I wanted to tell you before I move on. All right, so I guess this kind of brings me to what I brought up in the beginning, which is people seem to have different needs now than they did, say, you know, a lot of my formulas come from a book that's 1,800 years old. However, AIDS, fibromyalgia, what's another new disease? Stress. Sorry? There you go. Okay. All of these things, all I have to do with a patient is discern their pattern. So it doesn't really matter what you call it. Okay? That's why such an old medicine is still valuable. Okay? There was somebody quoted this ancient text, and in this text it said, well, what good are all these old point prescriptions and formulas? People are so different now, right? They were still applicable then, they're still applicable now. So, one thing that I wanted to say about overall treatment is that I said before how acupuncture and herbs are supposed to work together, right? So the acupuncture portion of it is like a reset button. Okay, so for pain, that thing that they did with your patient, right? I do that a lot with just different parts of the body. You know, you're using the teeth and the mouth as a representation of other body parts. I'll use, you know, your arm to treat back pain because I'm projecting sort of a holographic image of one body part on another body part, right? So this is the low back. If this is your head, this can be your torso, this can be your low back. Make sense? So I'll be using points here to treat low back pain, et cetera, right? So that's going to affect more functionality, okay? Whereas herbal medicine is going to affect more physiology. And the great thing about herbs is this too. You know, if you're in China and you get a prescription for acupuncture treatments, you're supposed to go every day. And, you know, here your boss isn't going to put up with that. You know, you can't leave every day to get your treatments. So herbs are a way for somebody to treat themselves every day, okay, in between treatments. The other thing about acupuncture and herbs and the way that they work together is that when they're this individualized and you really know what's going on with your patients, it makes your success rate in treating their condition great, and it makes the side effects very little. Okay. Okay, so questions? Yes? Oh.
So when you showed that chart of the asthma differential, were those questions and symptoms specific for asthma, or?
That's a really good question, actually. We have this thing, it's called the 10 questions, and the 10 questions go through all the body systems. What's your thirst like? What are your bowel movements like? What's your urination like? What's your sleep like? What's your diet like? Do you have cravings? And all of those things will reveal those symptoms. Okay, so it's not specific to asthma. But when somebody comes in with a specific condition, then of course you have to elaborate, right? So I'm going to ask a lot of questions about asthma. You know, when is it worse? What makes it better? You know, are you coughing anything up? What color is it? I mean, we get down into the nitty-gritty of that specific thing. And all of those will help inform me with the diagnosis, okay? Make it really spot on.
Do you ever use pulses?
Oh, pulses? Yes, yes. Yeah. The question was, do I use the pulse to do diagnosis? And yes, it's not just the questions. That's a whole other aspect of doing diagnosis. I feel your pulse, I look at your tongue, that's sort of the ancient x-ray, okay? This medicine was developed before we could go into the body and do cool things like urinalysis and, you know, blood tests, which are so fun. But I look at nails. Yes, I'm gonna run up next time so you're not in trouble. I look at people's nails, I look at their hair, I look at their face, I look under their eyelids, I look at the way they talk to me. If they talk kind of like I do, which is really fast, and they interrupt my sentences, is that hot or cold? Yeah, see? So I pay attention to all of that.
I have a question for you.
Yeah.
I've always been told that acupuncture was about opening up meridians.
Yeah.
That's the objective, is that you get stagnant or blocked meridians, and the acupuncture is supposed to open up these pathways. Is that correct?
My objective is to make the patient feel better. Yes, if I want to really explain to a patient what I'm doing, the idea, particularly with pain, is that pain in Chinese medicine is caused by a blockage, okay? Like what was going on in people's mouths, right? It's a blockage. And that's why in Chinese medicine we don't particularly like ice or cortisone shots, because what that does is it freezes things. It continues the blockage. So when somebody comes to me and says they just got a cortisone shot, I usually say, you know, just come back when that wears off, because I don't want to undo it. I'm moving things. I want things to move. Once you move things, you don't have as much pain.
Well, I have stenosis in my neck, and I had, several years ago, I went to an acupuncturist because my left arm was beginning to go numb on me. And so I had several treatments of acupuncture, and it worked. Then it came back, and the acupuncture did not work the second time through. You know, then I had to have the, what is it? What is it? Epidural, yeah, in my neck.
How are you feeling now?
Not 100%.
Yeah.
But I'm better.
There are things that acupuncture can't do, you know. If there's something, some physical abnormality, Sometimes it can help, sometimes it can't. Also, if there's a movement, a repetitive movement that somebody's doing that is creating the pain in the first place, you have to stop doing that. You know, carpal tunnel, you can't just go get your acupuncture treatments and then sit back down at your regular old desk. You got to, you know, so.
My wife had tunnel carpal, and she went to the doctor, and the doctor was talking about cutting each of her hands separate times. And she's kind of stubborn, to say the least. And so she kind of listened, and it didn't fly in her mind, because she's an artist, and she wasn't about to be, you know, incapacitated. So she got on the internet, and she ordered this DVD, and she did it for 4 days. 4 days, and it went away.
What was it she was doing?
She's doing exercises. The guy guaranteed on the tape, he said, if you do the exercises, you know, religiously, like you're supposed to, you will be relieved of the symptoms. And it was actually magical. I mean, and to this day.
Nice. You know, one of my goals with treating anything is, you know, it's nice if people come back and see you every week. That's, you know, yeah, it's good business. However, I really would, I prefer to treat somebody and be done with them, you know?
I have a friend of mine who's a naturopathic doctor, and he cures people in a hurry. It's not good for business. You can starve to death, you know?
No.
Oh, yeah.
I disagree.
Oh, yeah. You got to have money to survive.
Shouldn't have to, but at least around here we do. So can you talk about something like gout, which has a very, what we think we know about gout is that it's got a very specific cause, uric crystals and stuff, and then the inflammation around that. How has traditional Chinese medicine looked upon gout, and how effective is it against something like that?
I've treated gout with acupuncture and herbs, and it's the same thing as what I just showed you, except if we're going to do acupuncture, we have to also look at the meridians that are affected.
Is gout a traditional disease?
Yeah. Yes, gout is treated by Chinese medicine. Yes. You know, Chinese medicine was developed as a system. That's all that people had. So it treats everything. However, you know, if it's really an emergency, just take me to General Hospital, right? So
Well, the question was a lot about whether or not gout was one of the traditional diseases, because it seems to be quote unquote a modern disease of excess. But okay, and so yeah, and Henry VIII set the tone, right, of gluttony, et cetera, et cetera, et cetera, right? You know, beer and whatever, but which are not really the indicators for it. But neither is, was it purine? No, Puric now, supposedly.
So did I answer your question? Yes, I can treat it. Is it a traditional disease? As far as I know.
Well, the real question was, you start out by saying the how and the why, and yet you skipped over meridians versus this and versus that. And so what I was looking for was a little bit more of the Chinese rationale around it as opposed to what we know from physiology.
Okay, so you could diagnose it with 8 principles. Gout is usually what? Is it hot or cold? Hot, right? It's inflammatory. So probably either going to give the patient cold herbs, or I may even do cold herbs topically to relieve some of the pain right away. Okay? It's inflammation, right? And inflammation is inflammatory, right? It's hot, fire. Yes?
You people are violating the rules.
So my first question is actually for you. What was the website for the exercise?
I don't know.
And the second question is, so is cancer disease or not, in your opinion? And have you had any success with cancer treatments?
I myself do not treat cancer. There are really brilliant people who treat cancer. Pine Street Clinic in Mill Valley. It's a subspecialty, so I don't treat it. But yes, if I had cancer, that's the first thing that I would do, is find myself an acupuncturist and a gifted herbalist, somebody with a lot of experience with cancer.
So is it a disease or something else? I don't know.
We still have to differentially diagnose it. Still have to. So, you know, people ask me all the time this question. Okay, Sharone, what's good for my gout? What's good for my digestion? And my answer is always, it depends on your constitution, right? I can't give a pat answer, right?
Have you read Otto Warburg? You haven't read Otto Warburg? Well, there's your answer. Cancer does not live in an oxygen environment, you know, alkaline your body, and you'll live to be 35.
Is it safe to suppose that the Chinese medicine practitioners often disagree? Well, no, that's just the warm-up. The question is, when they do disagree, do they try to settle the arguments by science or by authority?
Well, I don't think we have another hour for this. So let me say this. Yes, we disagree. There are many different types of acupuncture. For example, the thing I was showing you about the arm, a lot of practitioners just go right in. Back hurts, you stick the needle in the back. I don't think that's good medicine. And plus, when my back hurts, I don't want a needle there, especially if you can use the meridians. But, you know, I practice more Taiwanese acupuncture, which is more classical. TCM is traditional Chinese medicine. It's newer. It's not traditional, okay? So, and then the other part of your question, do they use science or what was that? Authority. It depends on the person, right? Now, this is the thing that kind of bugs me, is when people start mixing their paradigms up, you know, and start interjecting allopathic terms into their diagnosis or into their explanation of what's going on with their patient, or, you know, it goes on and on. Because you lose track of how you're going to treat the patient. It doesn't matter what allopathic term you use. You still have to differentially diagnose the patient in order to give them the treatment, right? So, you know, if you read any kind of older text in Chinese medicine, there's always some guy, and what he's doing is he's arguing with some guy from 200 years ago, and he's having a ball, you know? That's what it's all about. Well, you know, so-and-so said this herb does this, but really, I don't know what they're talking about. But the guy's been dead for 200 years, you know? But it's fun. So, oh, am I supposed to be down here? Oh, okay. All right. Anybody else? Quick. Ooh. You had something to say.
Quickly, I've had acupuncture several times for different things, very successfully. I'm an advocate. But when you were speaking about in China, where you would go every day, and here, obviously, our society is set up differently, would here I've always been told it's more beneficial to go more or less like a session of 10 rounds, and things will start clearing up to the point where a lot of the symptoms I originally went for are gone, but then just keep going for those extra times because you're really clearing other things. In China, what would they do? You know.
Well, I think in China, they're probably not making the same amount of money off of you continually going, so it's going to change, you know. When someone's done, and yes, you can make a living doing that, because when you really help somebody, they're going to tell somebody else. 90% of my practice is all referrals. So, yeah. Okay. Can I have one more question?
You asked me afterwards. All right. Thank you.